Hey y'all, Shelley here with another tip for hospice nurses. So you may hear me at times talk about the pre-transitional phase in some of my videos, and I've had some nurses ask me, how do you know when someone's in their pre-transitional phase? So that's what I'm talking about today. So typically what you're going to see in the pre-transitional phase is first a drop in the blood pressure. Sometimes it'll be a really sudden drop, but usually it's just this steady decline that every time you go, the blood pressure's lower and lower and lower. You'll also see a change in the heart rate. Either it's going to go up or it's going to go down. You may see a change in the rhythm as well. It may become somewhat erratic and irregular. You also will usually see a decrease in their O2 sats, and I think that's because the circulation is just decompensating at this point. The person will also usually stop eating during this phase, or just eating very, very little, like a few bites and a few sips of water throughout the whole day. They will also withdraw into themselves a lot. So they're not completely withdrawn, but minimal interaction with environment, sleeping the majority of the day and night. This is also the time when, if they are going to interact with their spirit people, they usually will see it at this time. And I find this to be a very joyous time. You can, if you sit with them, you can just feel the happiness and the love just radiating off of them. And I always feel so blessed to be able to share in these experiences with these people. But anyway, so during this time, the first thing I'm going to do is review the med profile with the physician, because there are probably some medications that are going to need to be discontinued, such as blood pressure meds, beta blockers, anti-hyperglycemic meds, anything like that could actually be detrimental at this point. Then you want to look at medications that can be discontinued, such as statins, vitamins, different things that are just no longer useful for the person. You want to get their medications down to only the bare necessities, because it's going to become more difficult to administer medications to this person because they are very minimal interaction. Then the next thing I usually will do is check their e-kit, because I want to make sure that what I think is in there is actually in there and not expired. And if they are expired, I'll reorder them. And then I'll make my plan for terminal secretions, like I talked about in a prior video. If this is a patient where we've decided that scope patches are going to be the best option, I will actually apply them at this point. It's not going to hurt them, and it will prevent the terminal secretions from forming if that is going to happen with this person. And then what I do is start talking with the family, doing all the education and the things that we talked about educating on. And I like to practice here what I call compassionate honesty. You want to be very honest with them and tell them this is a definite decline. We don't know how long this phase is going to last, because it could last days. Sometimes they just continue to decline right on into transition. But I've also seen this stage last for even a few weeks. So we don't know. So I'm very honest with the family, and I tell them, over the next few days, we may be able to give you a better idea, but this is a definite decline. If there are any loved ones or anyone that would want to come see the patient, now would be a very good time for them to come. I wouldn't wait, just in case. And also talk to them about the decrease in appetite and all the other things we talk about educating during the pre-transitional phase. And then the last thing I do during this phase is talk with the physician about increasing visit frequencies. I don't know that you necessarily need to increase the nurse frequencies to daily at this point, but definitely 3 or 4 times a week. And I always increase the CNA visits to daily, to 7 days a week, for 2 reasons. One, the CNAs know these patients better than anybody, and they're going to note any subtle changes or any continued trajectory towards transition so that we can intervene as needed. They'll let us know. And also, because there's going to be more family members present and more people sitting around the bed, it's very important that we keep the patient as clean and fresh as possible, and their bedding as clean and fresh as possible, because this is going to be probably the last memories that the family is going to have of this patient. And it's our job to make sure that it is as positive as it can possibly be. I hope this tip was helpful. If you have any tips that you think would be helpful for hospice nurses, please let me know. I'd love to share them here. And remember, together we can change our world.